Welcome, everyone, to today's webinar, Helping Patients Afford the Care They Need. My name is Brian Zimmerman, and I'm pleased to serve as your moderator today. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, though, I'm just going to walk through a few quick housekeeping instructions. We will begin today's webinar with a panel discussion, and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see there on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with your audio or video, please try refreshing your browser first and see if that resolves the issues. But we do have folks on the back end who can help, so do submit any technical questions you do have into the Q&A box, and they'll be in touch. So with that, let's dive right into some introductions. We've got a great group here today and a lot of ground to cover. So I'm going to tap on each of our panelists to sort of introduce themselves and share a bit about their current roles and organizations. And James, I'm going to tap on you to do the honors and get the ball rolling.
Sure. Thank you. I'm James Keil. I'm the CEO of Rosa Orthopedics. We're located in Northern California in Sonoma County, the beautiful wine country. We have almost a dozen doctors and about 10 therapists and 4 locations. And so we cover a lot of ground. I've been here for, it'll be 2 years in May. And so it was about 10 years in orthopedics for me. Prior to orthopedics, I was in the neurosciences world and ophthalmology world and lots of other specialties across healthcare in lots of different environments, including some hospital physician organizations and that type of thing. So I've kind of been in many different fronts and many different configurations in the healthcare world. I'm enjoying being in private practice again, and I've been in private practice, like I said, for the last 10 years or so. We're very nimble and we can move quickly and we can make decisions quickly, and it's really a fun and exciting way to deliver care. So glad to be here.
Great to have you. Really, really appreciate having your perspective on this panel, James. Thanks for being here. Kevin, let's move to you now.
Thanks, Brian. I'm Kevin Joyce, the CEO of Orlando Orthopedic Center. Been in orthopedic private practice management for over 20 years. Currently in this role for 17 years at Orlando Orthopedic Center, where we are currently Orlando or Central Florida's largest independent orthopedic practice, which plays into a lot of what we're going to talk about today. We have 9 offices around Central Florida, surgery center, 3 MRIs, PT, 8 or 9 PT facilities, 26 physicians. I think it's up to about 15 mid-level providers, and just all the other stuff that goes along with that. So excited to be on the call today and looking forward to the conversation and discussion.
Excited to have you, Kevin, and looking forward to diving here shortly. Darren, why don't you go ahead?
Yeah, I'm Darren Harris, the CEO of the Bone and Joint Institute of Tennessee. We're in Franklin, Tennessee, right below Nashville. We serve all of Middle Tennessee, Northern Alabama, Kentucky. We are a de novo practice that started in 2018. We started with 13 surgeons. We're up to 19 surgeons, 22 mid-level providers. We have 4 orthopedic urgent cares. We just opened our ASC in 2020. So we have a 6 OR ASC that we're running down there. We have 2 that are shelled out. So we have continued growth planned. We have physical therapy as well. And I've been in orthopedics about 20 years. Before I was with this group, I was with Ortho Carolina out of Charlotte, North Carolina, and then Emerge Ortho out of Raleigh, Durham. So orthopedics is what I've known for a long time.
Great. I appreciate that, Darren. Chris, why don't you round up the introductions here?
Yeah, thanks, Brian. So my name is Chris Hall. I'm the Director of Healthcare for Rectangle Health. Head offices are based in Valhalla, New York. I represent Orlando, Florida. So yeah, I've been in healthcare for about 7 years, mainly focused orthopedics, ENT, and ophthalmology. I've had my role with Rectangle Health for about a year now. And yeah, I'm here to pretty much service everything vendor related in regards to how it works in orthopedics.
Yeah, appreciate it, Chris. And I think having your perspective sort of integrated into this panel will be useful as we move through this conversation. So great to have you as well. Let's dive in here with the first formal question, which is, a lot of Americans, of course, are navigating considerable financial challenges right now, and some are putting off healthcare services due to cost concerns. So I'm curious if this trend has manifested in your specific markets, and if so, what responses have you rolled out? As you consider and think about sort of patient financial challenges. Darren, I'm gonna tap on you to get the ball rolling here, if you'd be so kind.
Yeah, absolutely. So we absolutely feel that in our market. The impact of cost of gasoline and insurance and all the things that are considerably going up. We feel like the people that have those high deductible HSAs, they have been slower to the market to kind of get their surgery done and their needed orthopedic care. And so the shift that we have started doing is about 6 months ago, we started rolling out kind of a cash base, a little bit of a discount off of the price of a normal surgery or an office visit. But we are advertising a cash-based service for those people that have those high deductible HSAs. They want to know what their cost is before they get here. It is better for their personal budget. It's easier for us to, not have to negotiate and haggle with each one of those people that come in. And so it's been a real benefit to us to be part of that transparency and pricing, and so that patients know what they're going to cost before they come into the building.
Yeah, and I imagine transparency might come up a few times in this conversation, Darren. So I appreciate you introducing that right away. James, what about you? Does transparency is that something you're working there at Santa Rosa Orthopedics focused on? Any other comments around what financial pressures you've seen in your market among patients?
Transparency, when we say that, I usually think of, a few years ago, there was this push for, and this is my interpretation of the word transparency, but there was a push a few years ago to have transparency in the way of publishing your prices, publishing, typical out of pockets or however else you think you could publish pricing. And there was a number of groups that really tried to do that and pushed hard to do it. And I'm hearing less of those conversations. We are certainly not doing that, because what we're finding is it's usually an individual conversation. I'm kind of a traditionalist myself, and the traditional way of doing it is, and each conversation is different, because each payer is different, each contract is different, all the way down to self-funded payer plans. Those products are different. Those out of pockets are different. So it's really about training and retraining and having more discussions with your staff about our approach with our patients is, to our best of our ability, to be inclusive of the episode of care. And I think that has changed a little bit over the years. We don't usually say, like we used to say, which was, well, we don't have anything to do with the facility. And so that doesn't really work today. So I think it's really about a full, deep conversation about how can we help you, the patient, understand the total out of pocket for the total experience. It's not just the physician fee, and then the facility fee is none of our business, and that's not how we approach it. I think we partner a little more closely with especially one of our ASCs, we partner more closely than we probably ever have in years past, just because they do a great job of the same thing we're doing, having a good conversation. And I think that's how we're approaching it. I would say, from a standpoint of frustration on the patient side, I think we're seeing more of that happen when a patient really needs medical care, but they haven't completely ironed out, is this workers' comp or not? And we have a lot of empathy for that. So we really try to work hard with those patients to say, look, let's just get you the care you need. It's terrible not to receive care when you need it, because the body's going to freeze up, you're going to stiffen up, you're going to have issues from delay of care. And that's really important to us, is don't delay the care. But I think that the financial side comes in a little bit more in those situations. The workers' comp situations where they haven't quite figured out, is the employer standing behind this?
Yeah, appreciate those comments, James. And a follow-up question for you as well, in terms of, transparency, not in the form of like publishing prices necessarily, but transparency in the form of having candid conversations with patients. Can you talk about, and you mentioned really training and focusing on staff to help them have those conversations. Can you talk about what that work entails in terms of preparing your staff to have these conversations? What information do they need to have? Are there soft skills you look for in perhaps folks you're going to be asking to do these conversations, these interactions?
Well, certainly it never hurts to look for the soft skills from a customer service perspective, but I really try to train them not to feel personally accountable for this bill that they're handing over to that patient or this dollar amount that they're handing over. So transparency in that regard is really about having a conversation. This is a touch base type of conversation, so that we are open from the beginning about all the information we have about their benefits, how much deductibles met. So there's some of that training that, I think is a challenge for some staff, because it's not necessarily their fault that we don't have, it's not like pharmacy. If you think about the way pharmacy has always been handled in America, it's been done really, really well. And nobody walks out of a pharmacy without, paying and then taking the pills with you. And this is much more complex. And so we have to train from that perspective. I understand that if it's complex for me, and I've been doing this my entire career, it's certainly complex for our staff. So I think starting from that perspective and training from the perspective of, yes, I understand it's a little bit nerve-wracking. You don't always have all the information you need. The eligibility and benefits isn't always clear. So we really try to work through that with our team and just give them a nice step-by-step process to go through. And then, also recognizing that when they take that to the patient, there's still that possibility that things have crossed in the claims process and deductibles may be met and haven't shown up yet. So we're trying to be as open and understanding about that complexity as possible in the training process.
Thank you, James. Kevin, let's turn to you now and get your thoughts on what you've seen in Orlando, in your market, and how you've tried to address it.
So Orlando's an interesting market, unique market. There's not a lot of Medicare in this market. I mean, there is some, but most of the Medicare is out on the coast, 30, 40 miles in each direction. So what we're left with is a lot of commercial, a lot of younger population who definitely, financially they have more challenges and more constraints. Mainly because a lot of our jobs in this market are service industry jobs around the tourist, tourist industry. And so as a result, we are challenged probably more than a lot of other markets. When I see other orthopedic practices that, their payer mixes are 50%, 60% Medicare, that's a big, that's a big difference, and that typically your Medicare population, doesn't have as many of the challenges that a commercial population would have. So we definitely have those challenges, and as a result, we have had to put in place a number of different types of programs and different measures to address attracting those patients and also making it easier for them, to access care and then also handle the financial impact of whatever their benefit plan, provides them on the back end. So similar to what Darren mentioned, we do have price transparency quotes on our website through a company called HealthMe. Some of you may have already had some experience with them. And you don't need the company to do this. It just happens to be the one that we selected to kind of make it more of a turnkey program. But for many of our basic services, MRI, PT, office visits, PRP injections, things like that, you can see, or you can actually view our pricing and actually pay for the pricing up front on our website through this platform. Similar to what James had mentioned about the surgery center and challenges between the surgery center and the practice, I agree 100%. It's you have to really be on the same page with the surgery center. We happen to own our own surgery center. It's 100% physician owned by our group. It's literally right next to my office here. So I have, basically the same surgeons are going there, our same patients are going there. So it's pretty much our own kind of, our own dedicated surgery center. So as a result, we have a lot of control and again, transparency between each entity. I mean, they are separate corporations, to make sure that patients aren't being overcharged. There was a while back that one of our biggest challenges in our practice was actually issuing refunds. Still a problem, Not as much because, you know, we were so good at collecting deductibles and collecting co-insurances and everything that often we would collect too much, and the financial burden was really, back onto the patient to wait for their refund. So we've done some things internally to make sure that that money doesn't get tied up based on when the claims are submitted. We also, this is going back probably 5 or 6 years ago. We're now up to our 5th urgent care walk-in clinic. So we feel that that's a very important element of this market, to provide a convenience at a lower cost alternative to some of the higher cost, the ER urgent care, where you're getting the quality, but you're also getting the value, because you go to the standard urgent care center, they don't know what they're doing orthopedic wise. They're still some of our top referrers. But we're now averaging about 6,000 new patients a month through our surgery or through our walk-in clinics alone. And I think that's testimony to the fact that that's a huge, attractive, service and a place of care for patients in this market. We're not the only ones that do that, but from an independent practice, it's I think been to our advantage to do that. So those are some of the things that we're doing in this market to combat. Again, we're kind of a unique market in that we don't have a lot of Medicare. We have a younger population that is going to be hit harder by inflationary pressures, by things going on in the economy, and we have to be, we have to provide them different solutions to help them navigate that.
Yeah, it sounds like being mindful of patient circumstances and trying to meet their needs and meet their needs through communication around price, but also location and services offered and how you're offering those services. Thank you, Kevin. Chris, I want to turn it to you now to build on what you've seen, maybe perhaps in Orlando, or even just build on some of the comments you've heard your fellow panelists here share. What's your perspective?
Yeah, so I'm going to lean on Kevin's beginning part of his statement. I mean, I'm part of that youthful society, so it's going to be a twofold approach for me. So as a patient, I tend to avoid going to any form of healthcare offices simply because I don't know what to expect. I have a high deductible plan, so there's always that concern of what it would look like. So going back to Darren's point, I think pricing transparency has been probably the pivot for what I've seen being, now I know what I'm paying, now I know how to afford it, I know what my deductible is, and I know how to approach it. So a lot of the clients that I'd say I'd speak to in the healthcare space are all taking different approaches to how you attack this market or how this is actually affecting the patient. But you want to make sure that, at least from our side, our goal is to, as a vendor, to provide really something that the office staff are comfortable talking about and giving patients more options to effectively reach those final goals. With that being said, we also don't want to affect the bottom line of the practice, because we know that there's a lot of physicians out there that want to give genuine care, but also feel like they deserve to be paid for it. So balancing that scale is really important from our perspective. And I truly believe it's made a huge impact, and it's probably not going to get easier as time progresses. So making those fundamental changes now will probably be the most essential from both a practice and a patient's experience.
And Chris, those comments sort of bring me where I think I'll jump to in our conversation, which is you're talking about different options, and there's been a lot here talked about already around what's really important to fostering an excellent patient experience. But I want to maybe just ask the question a little bit more, put a finer point on it. What are the offerings that are most important for fostering an excellent patient financial experience? Price transparency has come up. Is it multiple payment options? Is there something else we should add to this list that hasn't come up yet? Chris, I'm going to give you first crack at this one.
Yeah, so I mean, transparency is one. Options, when I think of options, non-recourse financing is definitely a huge option. Patients love the idea of being able to render a service now and not have to worry about the financial constraints until later. There's also a huge benefit for the practice, right? Being paid up front and not having to worry about sending a patient to collections after the fact. So that's one big option that we've heard a lot of through a lot of the clients that I've spoken to. The other one is card on file. It's used so much, everyone knows about it, but it's not as effective simply because most people are just opting to not have card on file. So something that we've really brought to the forefront is, as a medical practice, you have the right to store the card on file. Things like Amazon and Netflix, they have account updated technology. You should have the right to have that same account updated technology. where you don't have to rely on your staff to call the patient every time a payment needs to be made. This will just be something that happens automatically on the back end. It also works really well in workers' comp. So we've seen big turnarounds in both that, obviously making sure that you can do it effectively, whether it's through texting a patient and not putting additional stress on them. Patients as a whole are used to this market, right? Call it the quote unquote outside of healthcare market. Card on file is a thing. Texting is a thing. Having a credit card on your phone it's real. Why aren't we adapting those same options in technology in healthcare? And why aren't we making them use it effectively? So that's really my three biggest options and takeaways from what I've heard.
Thank you, Chris. Darren, I want to turn back to you now. In your opinion, either building on Chris's comments, what you've heard so far, but what are the really important offerings to give patients in order to really foster that excellent patient experience?
So I think Chris is exactly right. We have the card on file. We have the ability to schedule appointments online. People have adapted to the Amazon society where you get immediate gratification, you get payment that you don't have to put your credit card in every time. And so the more we can make it easier for the patient, the more likely they're going to choose us as a practice. And so we do that all through one system. It's our intake system. They can online schedule, they can pay their co-payment before they show up there. They get a balance reminder afterwards. We keep card on file. And, patients, there's some patients that do not want that and they can opt out of it, of course. But for me personally, I don't want to have to pull my credit card out every time I have to make a bill online. And so having that credit card, stored is a good resource, and it makes it easier for the patient. And so we've done a big shift, as James was talking about, on educating the staff. We've made a big shift in recent year and about the last 18 months because we've seen such a shift with these health savings accounts, these HSA accounts that have these high deductibles. We have made a big shift to, we call them financial counselors. So before we just had schedulers that would just schedule the appointment, they would get them on the books, they would get it scheduled with the hospital or the ASC, but we would never really educate them on what their portion of that payment would be. And so about 18 months ago, we shifted 2 of those surgery schedulers to financial counselors. And so now their primary responsibility is to sit down with that patient saying, hey, this is your deductible portion that you'll pay us. We're in partnership with the hospital and the ASC that we own. And so we know what their pricing scales are as well, and pricing fee schedules. And so we even tell them, hey, this is going to be your out-of-pocket portion for the surgery center as well. You're probably going to have 12 physical therapy visits on the backside of this. Prepare for that. We don't collect that up front, but we do educate them that, hey, this is the entire cost of this. And it has considerably improved our patient AR. So that responsibility that drops the patient after the surgery, we have gotten significantly better. And I think as orthopedic practices and healthcare in general, I think we have to do better about educating patients on the front end. We're one of the only industries that you don't know the price before you get there. And so I think there's a gradual shift in our society to know those healthcare costs up front. And we want to make sure that we're cutting edge and on the front end of that for sure.
A follow-up for you there, Darren, thinking about the staff, you switch from schedulers to financial counselors. What has that experience been like for those employees? Have they embraced that shift? Is this work they really feel gratified by?
And so we had to pick and choose the people. It's not great for everybody because there is that uncomfortable ask where they have to ask for that financial, credit card payment or debit card or whatever it might be. And so we picked the people that we wanted, that we thought would be most apt at asking. And so we even changed the terminology. We really don't ask for it. We say, how would you like to make your payment today? Because if you ask them, do you want to make a payment today? That gives them an opportunity to say no. And so the terminology has really shifted for us. It's like, how would you like to make that payment? You do have a financial responsibility to, after the surgery, what form of payment would you like to put on record so that we can bill you after the surgery? And so once we change that terminology, it became easier for the staff to just say, hey, this is not a personal thing, but you obviously are going to have financial responsibility at the other side of this. And we want to make sure that you're aware of what that is, but we are also prepared to collect that payment.
Thank you, Darren. Kevin, moving to you now. What would you say on this question in terms of what are the offerings that are most important? Anything to build on, add to the list here that's already come up in terms of, you know, the different payment options, convenient card on file. Anecdotally, I'm just thinking in my head that Darren, like you, if my credit card's not on file, I'm less likely, if I've got to go find it, dig it out of my wallet and punch it in, I'm less likely to buy whatever I just put in the cart. It might just sit there and I might not get it. But Kevin, anything you can add here?
Yeah, no, there's not a there's not a ton to add. I think Darren's summarized what there is available, and I think a lot of groups are starting to pick up on these different trends and these different solutions. So all the things that Darren mentioned, we're doing a very similar types of activities. We've done estimators, we've done credit card on file, online appointments. I think the biggest challenge I have with those services is, I think the technology is evolving. Not that it's rocket science, but I think the companies are getting better. The EHR companies are starting to try to figure things out too, versus adding third-party vendors to your mix of different, bolt-on solutions, as I call them, because we have so many different bolt-on solutions that are attached to our practice management system or our EHR that eventually it becomes somewhat cumbersome. You need, sometimes you need people to kind of manage those different processes because, sometimes they work, sometimes they don't work. So I think everything that's been mentioned is where a lot of the activity is continuing to go as far as practices, especially the private practices. I think we have to be on that leading edge, as Darren said too, because the hospitals are big. They're slower to adapt, but they're getting there too. And they've got a lot more money to spend and people to put, resources to put into it. So, our biggest challenge really is convincing our doctors to spend the extra money, that this is something that's worth it, because they just look at it as sometimes it's just overhead, it's another person or another position, but you've got to really do the you got to show them the numbers and say, look, if we're successful at this, we may save some staff in the long run, we may collect more dollars. Of course, the most important thing, with all of this, obviously we want to make money for our practices and our doctors, and that's important, but we want the patients to be happy and satisfied. And I think the more difficult you make it for them to do anything, whether it's making an appointment, pay their bill, find the doctor, sometimes it's, not sometimes, but it's becoming more of a reality. It's they don't even want to leave their house to get the care. And so you've got to have a solution for almost everyone. And I think the battle is with, especially in the private practice setting, is getting the doctors to get on board with it, making sure you have the necessary resources, that these solutions are working correctly. So partnering with the right vendors, having the right people supporting those, so that things don't just fall through the cracks. So that's my addition to it is confirming that. It's just, sometimes the hard part is just getting it implemented and getting it off the ground, because I'm sure all of us who are in the orthopedic business, running small to medium size or large practices, know that we have 100 balls in the air at any given time, and it's like, okay, which one do we want to make sure is still in the air, which one we don't want to drop, and which ones are the ones that are the high priorities. And sometimes the things that make the most sense aren't always the things that you're spending most of your time on. So you got to make sure we're spending the right amount of time and it's prioritized. So it's hard. I deal with this every day with my physicians. It's like, sometimes you got to convince them, you got to spend a little bit of money to make a little bit of money. And that's the part that they have the hardest time really understanding. Like, why are we going to spend $100,000 on this solution? Because, it does this or does that. Can't we just do can't we do that now? I'm like, no, it just doesn't work, because Amazon wouldn't be able to work that way, and all these other companies wouldn't be able to work that way. So
do you think that, you mentioned data, you have to come to the table with data to convince physicians to get on board, but you also mentioned really talking about framing it up, I guess, in terms of this will benefit the patient. this is for the patient. Do you think that is a critical component to when you come to
Oh,
the table, is bringing it back to like, hey, we're doing this for our patients?
absolutely. So the perfect example is the online appointments. So we're doing online appointments. A lot of groups are doing that. And when we first introduced it, our physicians didn't want to do it. They're like, this is a lot of money. We have all these people making appointments now. Why do we need this? And the short story is, 2 years later, 1,000 patients a month are now making their appointments online at Orlando Orthopedic Center. And that's the end of the story. Now they're like, we can't live without it. I'm like, you're right, we can't, but you got to get there first. It's kind of the growing pains. You've got to invest in new technology. You got to find the right partner. And I'm not saying we have the best partners with all these. It's just that you've got to go, at least you've got to make the move, because if you're back in the old days and you're doing everything, at your front desk, and you're doing everything paper, and you're sending out paper statements, and you've got people on the phone calling during business hours trying to collect money, you are going to die. You're not going to make it, because no one's answering their phone. No one's, no one really has, the technology, they do, but they don't have like the best technology to be able to say, okay, here's what your bill today is going to be. So I think it's, the online appointments is a great example where I had to show them what this potentially could do, and that it really isn't necessarily a financial benefit. It's going to cost us money, but it's what the patients want. And that's important, because for us, it's just as much about market share as it is for the hospitals. If you don't have patients, there's not much you can do, no matter how good you are, if you don't have the patients coming in and they're going to your competition.
Thank you, Kevin. James, going to you now. Anything to add, or anything you'd like to reemphasize for attendees from your perspective?
Well, I love this. I love this technology focus. And I know that when I say this, I'm going to have the sympathy of all of you, that we're in the middle of an EMR migration right now. And you all know what that's like. But a lot of that is driven by our discussions about our technology limitations that we've been under. We don't want to spend a ton of money to get what we think is ubiquitous technology. If sometimes it's as simple as just text communication, but in healthcare, certainly it's got to be compliant. So then you have to be careful with that. But I think it's, trying to hit the easy button for patients. And sometimes I think we don't know. I certainly don't feel like I know what they're really pushing for. And I think sometimes they don't know till they use it. Maybe it's like the online appointments comment. You don't know how easy that is until you're using it, for both sides, for us, for the patients. So I'm in the middle of looking at everything, to some degree, going through this migration. I don't think we're going to end up in the situation, like Kevin said, with so many bolt-ons, it just gets a little bit crazy. So we're going to have some bolt-on limits. So some of the things we're doing is looking at just, it's outside of, it may not connect to our systems, but it'll still be the same technology. And texting is one of those. That are we going to have text to pay? I don't know. I don't know yet. I think that's something that, again, we're going to try to find the easy button. Excuse me. So we might use something outside the system. Maybe it's like Square, something like, credit card options like that, where, we're focused on giving the easiest option to the patient, even if we have to do some of the manual side here. If it's not connected to the system because of restrictions on bolt-ons or whatever, now we would consider doing something outside the system and do, manually post it ourselves. If it makes it easier for the patient, I think that's critical for us.
Can you talk more, James, about how you're thinking about, you got a lot of decisions to make, like you said, coming up. Can you talk more about maybe what process you have in place for making some of these decisions? Who are the folks you're talking to, your organization? How are you getting the patient's perspective working in here? It sounds like that's really important. Any thoughts or information you can share on that?
I'm actually interested in hearing. We haven't really done like a focus group on what patients are demanding. So that's one of the goals of maybe an outcome of this Zoom call, is to learn something about what have you guys experienced with what patients are pushing for. Do they really want technology in the palm of their hand on their phone? Do they really want to stop speaking to us over the phone? So I think we focused more on internally, and it wasn't just going to all of our medical assistants, for example, and saying, all of you, wouldn't you love to have this tool? It's more of kind of a one-to-one, believe it or not. You know, we've gone to like a surgery scheduler at a time, and we said, hey, do you want to pilot this? You know, texting solutions, that kind of thing. And so that's how we've done so far, but I feel like we are a little bit remiss in really knowing what the patients are going to demand. I know what I demand as a patient. I just don't know that I can speak for all patients. And I've always surmised that if I'm trying to get an appointment or pay a bill even with, you know, a medical provider, I want you to be able to catch me anytime if I'm walking through Target or something and say, hey, you know, we have this opening for your appointment, but don't bother calling me, because that's 150-year-old technology. So I think that's our focus, is trying to get away from that, focus a little more on the way that we interact in the rest of our lives. You know, somebody, you know, kind of used the Amazon comparison. It has to be simple. It has to be easy. It has to be in the palm of your hand. And I just don't think that more of people on phones is the solution. I just don't. And that can stretch into the financial side of our transactions, but also the medical transaction, just getting the appointment, getting the follow-up, moving their appointment when the physician's stuck in surgery or late getting out. So that's kind of my focus. But like I said, I really would love to hear more about what patients truly want. So if anybody has done that, have you had focus groups or inquired or done polls or surveys on your patient population? Have you learned anything?
Joyce, I actually think it might be useful to hear from your perspective in terms of what you see out there that patients really want.
I'm sorry, was that pointed at me?
Yeah, that was you.
Yeah, so from all of these conversations that I'm having, I think this is all really good insight. A lot of what we've seen, and James, this is to your point, I'll just use texting as an example, but if you think about Home Depot, for instance, right, you swipe your card once with Home Depot, whenever you go back, they always have your financial information. No one ever questions that, right? Why does it have to be questioned in healthcare? So same with the Amazon concept. So I think when it comes to the actual phone and using the phone, it's a level of convenience from a patient's perspective. So when it comes to text to pay, or even having the ability to apply for financing through your phone, knowing that there's multiple options out there that will still correlate to the practice. I think from what we've seen, right, if you think of paper statements versus texting, paper statements have an adoption rate of, let's say, just under 30% of being paid. And practices are spending a ton of money on statements. Texting, as we know, everyone has a cell phone. You have a 98% open rate. And just based on our client market, we have a 77% conversion to payment rate. So how does that translate on the back end? What does that financial structure look like? How much are you actually saving and how much are you profiting just by having that cash on hand? So from what I've seen, patients like the technological advancements because everyone else in the space is doing it. Healthcare is teetering a little slower than everyone else, but patients still have a high level of expectation, just like online scheduling is. I never want to call the practice to schedule my appointment. I would love to just take a photo of my insurance card, send it through to them, schedule my appointment at a time that works for me, and rock up, sign my paperwork on my phone before I even get in there. COVID was a big, real push for that out of the practice experience. So any patient that has the ability to do that before they even walk in, all they're doing is walking in, seeing their physician and walking out. Everything else is taken care of. So it really comes down to the patient journey and their experience and making sure that the practice reaps the rewards from that.
Thank you, Chris. And we are going to jump to some audience questions here shortly, but I want to ask each of you to share maybe one actionable takeaway with our attendees in terms of how to help patients afford the care they need, support that better patient financial experience, drive collections, all that good stuff. So any actual takeaway, any tip you can share with attendees, they'd be very grateful for that before we jump to some audience questions. Darren, I'll give you the floor first.
Yeah, I think the biggest tip is what we've talked about is, James asked, did we do surveys? And I think I kind of used the same mentality of where I used to pick practices. If Starbucks was there or a Chick-fil-A was there, it was probably a developing area that I felt like I needed to move into that market. And so I do the same thing with technology. Amazon, Apple, Netflix, everything is done through their phones nowadays, and everyone is very comfortable with that. And so I pick vendors that will help me reduce my FTE loads for my full-time equivalents, because none of us are able to hire right now. I'm assuming maybe Orlando is a better spot than Nashville, but anything that I can move to more computerized AI, anything that helps me reduce my need of employees. Not that I'm trying to get rid of anybody. In fact, I'm constantly hiring, but anything that can help me replace an employee that I can move to a different area with some kind of technology is what I'm looking for. And the bolt-on scenario, you're absolutely right. We can get buried in bolt-ons. There's multiple different usernames and passwords, and they all get updated at different times. But I think there is no one solution that works best. I think you have to have multiple solutions. You have to be at the most technological advance. So, none of us like this. Changing an EMR is the most painful thing that you can do in a practice. But you have to be able to try new technology, sample them through your clinic, and not being afraid of change. And so we talk about that when we bring every employee on. One of our core values is that we'll be a state-of-the-art orthopedic group. And to be state-of-the-art means that you're not complacent and compliant and doing the same things you've been doing forever. You have to be constantly going out there looking for the best technology and not being afraid to do those transitions. And so that's not easy on any of us. And to Kevin's point, it is not always the most financial viable thing to do, but patients are demanding it. And so if you want to keep the market share that you currently have or improve on that market share, you have to go to where the patient is rather than the patient come to you. And that is a change in healthcare. It used to be we would put a practice anywhere, they will find us, they will call our call center, they'll wait 10 minutes to get through. Patients do not want that anymore. They will find somebody else that is more technologically advanced to get them there. No one wants to have to make that phone call anymore, including myself.
Thank you, Darren. Kevin, what would you add? One actionable tip to leave folks with?
Yeah, my takeaway, and I'll try to go in a different direction because I know we've talked a lot about technology and the different solutions that are out there and all the services. It sounds like we all are doing a lot of the same things. It's just different flavors of the same stuff. So my takeaway is as a leader in an orthopedic practice, and obviously we're all orthopedic groups, and I'm assuming that most of the people that are going to watch this are probably going to be orthopedic, as far as specialty, but there might be others. And I think this takeaway applies not just to the orthopedics specialty, but also other specialties as well. My thing is within our practice is we've got to look at what differentiates us in the market. And we can chase. I tease my staff all the time. We're always chasing the wind, so to speak, with new trends and new things. And some of them you just have to go there and experience it, whether you make the right decision with a vendor or not. We all do that. However, we are most of us are in very competitive markets with large hospital systems, large corporate medicine competition in our market. And we really all have the advantage out there in our practices. Whether we use technology or not to figure it out is we all have surgery centers, we all have our ancillary services that we provide. And for the most part, you got to do a little bit of the research and the data collection on this and do your due diligence. But for the most part, we are the most affordable option for care in our markets. And we got to figure out how to spread that message, and we got to figure out how to convince the population out there why we're different. And we spend a lot of time doing that. It's not easy to do because we don't have a lot of money to spend on TV commercials and billboards like our hospital competitors do. So they bury you that we're number one, we're the best, we're the highest quality. That's what they do. And they just keep changing their campaigns around, every 6 months to call it something different. What we need to do continuously and we just got to keep figuring out ways to push this message out, is that we are typically just as high quality, if not better quality than the large institutions, the large health systems. We are definitely less expensive or higher value. We are in almost every case more convenient. To James's point at the very beginning about being in private practice and being able to pivot and being able to make decisions, we can do that and run circles around these large health institutions, and they may have more money and they may have the more resources, but we can do things faster. And my example is that I beat the two largest health systems in this market. One is Advent Health, that's now partnered with Rothman Institute. The other one is Orlando Health, that bought our other big competition, Jewett Orthopedic Clinic, here several years ago. And we beat them in a Cigna bundled payment specifically geared to self-funded employers and health plans. And we beat them bad, and we're not that it's the answer to all of our issues, but it's doing everything we've said. It's providing easier access, more affordability, better communication, because these patients have concierges that they can contact. So my takeaway is figure out what you're doing different and capitalize on that the best you can. And sometimes it's very simple. I mean, we're going to health fairs and we're going to different meetings of societies of HR people and risk managers in our market. And we're getting up and telling them that if you're looking for a lower cost solution for your employees to go get their care, come talk to us and we'll tell you how. And that would be my takeaway, is figure that out.
Telling that affordability and convenience story, right? Getting that word out there. James, what's your takeaway or actionable piece of advice?
Well, I first want to say I agree with what Kevin just covered in terms of we are already lower cost. I mean, if you think about what it takes to go through an ER versus ortho urgent walk-in, that's a no-brainer. The money savings and all of that. So we are an avenue of healthcare in that regard. That's already less expensive, and I think that's where patients should be going. I think that's where payers want them to go. Payers stopped authorizing certain things in the big facilities. Certain imaging tests that they're just not going to authorize it at the expensive place. They're going to authorize it at an MRI like you would have in a practice like ours. But my actionable item kind of gets a little more back to the financial side of things, and not just measuring how much money did you take, how much money did you take over the counter, but it's more about measuring. We can't manage what we don't measure, and vice versa. So that's my actionable item. I just, good old fashioned, make a simple dashboard, measure how many touch points your staff had on the financial discussion. It's not even about you didn't get enough, you didn't take enough money over the counter. It's about, did you have enough conversations and what was the outcome of each one of them? It kind of gets back to, for years and years, I've tried to measure, and it's not easy to do. If somebody has a solution, let me know. It's really hard to measure. Did your staff collect what they needed to per the anticipated EOB? So yes, you can do pricing, formulas, pricing models, or pricers, I guess you could call them. Nothing really tells you, your practice management system, most of them can't tell you what those 200 people that came through your doors really owe for what you performed. It's pretty frustrating. So I think the issue is to do your best to measure, set up some sort of dashboard so all 200 people that came through our doors, here's what our staff did in the touch points across that visit, to address if they'll have out of pocket, if something needs authorizing. It's a little old fashioned, but it's the way to do it. You have to measure and manage what you measure. And I just think that you have to have dashboards of some sort to do that, because there's nobody that's going to tell you, an auto-generating report is almost non-existent. There's no report coming out of any system I've seen that says you were supposed to collect X amount and you only got this amount, unless you were only looking at prior balance. That's easy. We know that there was a prior balance on the account, that we can visualize that, just look at it. But everything else is kind of an estimator. And so you'll never really know if you got the right estimate. You'll know if you were in the ballpark or if you had the conversation. And I think that's the challenge, is to put something together this is a quality control item. And every day, every patient that passes through your doors, your staff has to count what they did with that patient.
Right.
That's
So we,
yeah.
Thank you, James. We've got measure, we've got telling that affordability, convenience story, and we've got trying on the technology to see what really fits for you and your markets. Chris, what would you add before we take maybe one audience question?
Yeah, so I'll just keep mine short and sweet. I mean, I agree with pretty much everything the whole panel has said so far. I think from a patient side, especially in private practice, I'll be honest, I never knew private practices were better priced or more affordable than a hospital system, because there's always the unknowing, uneducated side of me. So part of, my biggest takeaway, I would say, between physicians and healthcare educating patients, we should be at least telling them that physicians are not only there to take care of your physical health, but also your fiscal health, knowing that you can take them through that journey from both the care and a financial perspective. I think that overall just creates a better financial journey, a better patient journey. And these are people that are always going to come back to your practice. So retention is going to be pivot and key from there as well. So that's my biggest takeaway. Our CEO said it, and it's literally stuck with me ever since.
Thank you, Chris. Thank you, Darren. Thank you, Kevin. Thank you, James. Truly appreciate you all being on this panel and sharing your insights with our audience. We're going to take now maybe one or two audience questions. As a reminder to folks out there watching, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. And we'll get started with this one. I think I'll open this up to the group here. But the question is, do you have any best practices on how to begin building bundles and displaying pricing?
I can jump in on that one. So this is challenging for all of us, and the ones that have accomplished that is very impressive. I think that you have to have a partner facility and anesthesia group first and foremost. So you have to start with someone that you can negotiate on a bundled payment with. So we are fortunate that we own our surgery center. It sounds like Kevin and James both do as well. And so you can negotiate those contracts. Pulling an anesthesia group is obviously a requirement as well. We have tackled it the same way that sounds like Kevin has tackled it, is we're going to the self-paid direct to employers model. We've tried to work with the payers, and they're either, and this is not meant to be an insult, but they're not sophisticated enough to adjudicate those claims as a bundled payment, or just unwilling to accommodate that. And so we go and push the employers and say, hey, we can give you, a total joint for X, and the cost before you have the surgery done, where a lot of times they don't. They'll go in there and they get a surprise bill like everybody else does, 60 days later. And so that has worked for us, but it's continuing to grow that model. It's not a huge portion of our total surgeries that we do now, but it's enough that it kind of keeps us encouraged to keep trying more and more.
Thank you, Darren. Let's take at least one more audience question here before we sign off. So the attendee asks, as more and more providers are trying to simplify the self-pay process by publishing the price of surgeries or procedures, are you seeing an increase in patients negotiating the cost of care?
I don't see a whole lot of the negotiation side happening. Haven't seen that. Have not had my staff come to me and say, hey, we've got patients, that are wanting to negotiate. Sometimes they for a high dollar procedure that we pre-collect on, they may negotiate how much of that pre-collect they pay, 50%, and then we'll try to collect the other 50% on the back end or something, or put them on a payment plan for that balance. But not really going to like the I don't know what you would call it, like the shopping market on your vacation, where you go in and, hey, how much are you willing to let that go for? I don't see that happening. I really just, what I see is that patients are just appreciative that you're making the effort to communicate and be transparent, and it doesn't even require that you post your prices, even though we do with some of our services. I think it's just that they're getting that information and able to make an educated decision, or at least budget and prepare, versus being surprised, as Darren was just saying. Nobody likes surprises. So I think as long as you're upfront, I don't think you're going to have a lot of patients, wanting to try to negotiate. I mean, we may eventually get to some place like that, but right now I don't see that happening, at least in our market, our practice.
Hey, Brian, I'll add to that. Part of the transparency and pricing that we did here at the Bone and Joint was because the physicians were coming to us trying to negotiate prices for their friends or family members. And so rather than trying to negotiate on the backside with our actual providers, I just said, we're gonna have a cash price. This is going to be published price. It's going to be the same for everybody. And so it helps eliminate the back channeling as well.
Excellent. Thank you for hooking on there, Darren. We are at time. I want to once again thank our great panelists here for this conversation. It's been a pleasure. I also, of course, want to thank Rectangle Health for helping Becker's put this on and putting this conversation together. To learn more about what we talked about today, attendees, you can check out the resources section on your webinar console and fill out the post-webinar survey as well. Thank you so much for joining us. We hope you have a wonderful rest of your day.
Thanks.
Thank you.
Everybody.